To those who defend our freedom, to the families who stand by them, your service to our country means everything to us. Welcome. Welcome to our family, the U.S. Family Health Plan at Martins Point, a TRICARE Prime military health benefit.
One of the big perks of retirement was the fact that, wow, now I get to become a member of Martins Point as well, and I get to have this great healthcare system that's so easy to use.
When I'm in Iraq, it's going to be a great feeling to know that my family will be taken care of health-wise, because without your health, you have nothing.
I'm just amazed that a company like Martins Point could just make things so much better.
Martins Point, unscrambled the whole thing, and really made it a lot easier for us.
There really is a company that really cares about who we are.
For the next few minutes, we're going to tell you about a TRICARE option you've earned but might not know about. A health care coverage plan that is working to improve the lives of military health care beneficiaries. A plan that offers benefits to military retirees and their eligible family members, including those aged 65 and over. A plan for families of active duty military, including activated reservists and National Guard members. A plan that offers all the benefits of TRICARE Prime plus additional services. A plan that gives you the benefits you have earned with the respect and personal attention you deserve. Let's begin with the big picture, your TRICARE healthcare coverage options. It may seem complicated, but when you break it down, it makes sense. As a military beneficiary, you have three basic options when it comes to using your military healthcare benefit. The first is TRICARE Standard. That's what you use when you show your military ID at the doctor's office, and you typically pay 20% of whatever your doctor charges. The second is TRICARE Extra. Extra works the same as TRICARE Standard, except you save an additional 5% if you see TRICARE network providers. TRICARE Prime is different. When you enroll in TRICARE Prime, you get more coverage and generally pay less overall for your health care. In many regions, there's only one TRICARE Prime option available. But in others, you have another choice for TRICARE Prime, the U.S. Family Health Plan. And in northern New England, upstate New York, and northern Pennsylvania, the U.S. Family Health Plan is brought to you by Martins Point Healthcare. Now, before we get started, if at any point during this presentation you decide that you'd like to speak with your local representative, just return to the main DVD menu and click on the Local Representative tab. There you will find the contact information for your local benefits specialist. Here at Martins Point, our military roots run deep. And when you talk to us about your TRICARE options, you'll find many of us are former military ourselves.
I get to meet a lot of people that I actually served with in the Air Force over the years. And I'm able to relate to them in the same way that I was able to relate with them while we were in the service together.
And it really is a nice fit between my military career and Martins Point, because I get to continue that military time taking care of people who are currently in the military or who have retired from the military like myself.
Martins Point was selected by the Department of Defense over 25 years ago to deliver this service. Ever since, we've been dedicated to exceeding your expectations. And according to our members, it's working. In a recent national survey, the U.S. Family Health Plan at Martins Point received the highest rating for overall customer satisfaction with a health plan from among 241 health plans.
Well, I think the reason that members are so satisfied with the plan is the fact that all of the people at Martins Point are very, very concerned with providing the best possible care and service to our members. They acknowledge our members as an individual. They're not just a number at Martins Point.
Clyde Park began his military career right out of college. In 1966, he joined the Air Force and served time in Vietnam. 10 years later, he joined the Air Guard in Burlington, Vermont, where he recently retired as a Chief Master Sergeant. Today, Clyde and his wife Peggy are fulfilling a lifelong dream, raising cattle on their new farm.
Having a health plan that deals with those things that come up all of a sudden, it's just so important to have a company that really cares about you. And I can't say enough about Martin's Point personally. They really care about you as a person, which is such a breath of fresh air.
You know, we're large enough to be able to provide everything that a health plan should be able to provide, but we're small enough to be able to take a personal approach to each and every member.
You call and you don't get put on hold. They obviously have a lot of people in the background working. They're pleasant. They tell you exactly what you need, and then you can follow that through. And I like that. I like that. There is a system, and they work it, and it works. It really works.
Martin's Point is a different kind of healthcare company.
One thing we'd like to point out, the U.S. Family Health Plan at Martin's Point is not a commercial insurance product. This is a benefit that our potential member has earned through their military service.
I think it's very obvious that U.S. Family Health Plan cares about the people that they serve. They make it easy for them to access our services, and they make it simple all around for all of us to do the best job we can.
From Maine, New Hampshire, and Vermont to upstate New York and in northern Pennsylvania, the service areas of the U.S. Family Health Plan at Martin's Point offer established local networks of hospitals, primary care doctors, specialists, and pharmacies. Healthcare shouldn't be complicated. At least we don't think so. That's why we have a simple system that gives you choice without all of the confusion.
The simplicity of the program works with our lifestyle. We have 6 children, so our home is constantly changing, constantly moving, and I really love the fact that this program it changes with our family.
Here's how it works. First, you'll select a doctor from our network. This doctor becomes your main point of contact. We call this your primary care provider, or PCP. Your PCP is responsible for coordinating and managing all of your medical care. There's a good chance your current doctor may already be part of our network. You can view a list of providers on our website, or just call us to find a doctor in your area. There are 2 kinds of care: emergency and non-emergency. In the case of an emergency, we want you to go to the nearest emergency facility so that you can be evaluated and treated quickly and completely. Just make sure that someone notifies your PCP within 48 hours. However, say you're not feeling well or you've injured yourself. Simply make an appointment with your primary care provider and he or she will do the rest. Your PCP will refer you to specialists, arrange your hospitalization, and authorize urgent care, x-rays, lab work, and other medical services for you when necessary and appropriate. They'll even manage all of your preventive health care needs. Keep your medical record updated, and take care of most of your paperwork.
Once you pick that doctor, you have one person that you have to deal with as far as your healthcare needs, and then of course you have the entire Martin's Point to back you up and to take care of any other issues that may come up. So.
The U.S. Family Health Plan at Martin's Point has given us peace of mind, has given us peace, lots and lots of happiness. They make sure that in such a crazy world with the economic situation and all these things going on, that the one thing you don't have to worry about is your health care.
At a time when the cost of health insurance and health care are at an all-time high, almost 50% of Americans say the cost of health care is their #1 economic concern. One study shows that retiring couples will need $200,000 in savings just to pay for the most basic medical coverage.
It's a sad day when a military retiree needs health care, doesn't realize what he has, and then spends thousands trying to get taken care of when it would have been so easy to have just been with our plan.
I like to think of myself as an educator, an advocate for the military beneficiary, if you will. A lot of times, these folks have no idea of what their health care benefit is, so I take great pride in pointing out what their benefits are and how we can be of service to them.
As part of the military community, you have earned your right to comprehensive health care coverage at low or no cost at all. And the U.S. Family Health Plan will cover you regardless of any pre-existing conditions you may have.
What's really interesting is to watch the reaction from families when they realize that the actual amount that they're going to be paying for their health care in the retired status is actually what people are paying monthly or even weekly in some cases.
With the U.S. Family Health Plan at Martin's Point, what you pay depends on your status. For example, if you're an active duty family member or you have Medicare Part B, you pay no enrollment fee at all. Retirees and dependents not in Medicare B pay the same enrollment fees required by regional TRICARE Prime programs. $230 annually for a single applicant, or $460 annually for a family of 2 or more people. That's right, not monthly. These amounts cover you for the whole year. Now, let's take a look at some of the covered services you're entitled to, like office visits, specialist office visits, and inpatient hospitalization. For active duty family members and Medicare Part B participants, there are no co-pays for office visits, specialist office visits, or inpatient hospitalization. That means you pay nothing. Retirees and dependents without Medicare Part B pay just $12 for office visits and specialist office visits, and $11 a day for inpatient hospitalization. Under the U.S. Family Health Plan, you won't need to worry about the high price of prescription drugs. We've got it covered. When you fill a prescription, you'll pay a low co-payment that falls into one of 3 categories. You'll pay $3 for generics, $9 for brand name medications, and $22 for your non-formulary medications. And as a member, you'll use our mail order pharmacy, where you can get a 90-day supply for only 1 copay and a savings of 66%. From enrollment in services to prescription drugs, the U.S. Family Health Plan at Martin's Point brings you the superior benefits you have earned. It even compares favorably to other federal health plans, like the plan David Boyce and his family received through his job at the Department of Labor.
The cost of going to your physician is less than what it is with the other federal employees. That's your primary care physician. The cardiology appointments, the copay is less. The pharmacy is less. An annual eye exam, $0. So it's a great opportunity to get a lot of health care for a very minimal cost.
To see our complete summary of benefits, visit the main menu of this DVD and select the Summary of Benefits tab. Now that we've shown how the plan works, let's take a look at some of the additional resources you'll receive at the U.S. Family Health Plan at Martin's Point. Diana and John Kleins were enjoying the good life when the unexpected happened.
He had planned to have a hip replacement. During the interim, I was diagnosed with cancer, so I told him to go ahead with his surgery.
And then, during his routine surgery, John had a heart attack. He underwent a double bypass, received a pacemaker, and spent many weeks in intensive care on a respirator.
I really did not know what to do, where to turn. I was alone. Unfortunately, I had my sister and my friends, but I needed someone with a medical background to help me.
That's when Diana dialed a phone number on the back of her U.S. Family Health Plan member ID card.
This girl, Lori, she has a very calming, soothing voice, and she would walk me through the medical issues. Does he need this? Can I get a second opinion? What can I do? What should I do?
Lori is a Martin's Point health coach. Health coaches are specially trained healthcare professionals, including nurses, respiratory therapists, and dietitians. Think of it as 24-hour access to medical information and support. They're there to help you with treatment decisions, support you in the daily management of a chronic condition such as diabetes, and send you reliable health information, including free video programs from our video library. Diana talked to Lori about John's issues and options, and Lori helped Diana understand her husband's medical condition. She also connected her with Anna, a Martins Point nurse care manager.
The first time I spoke with Diana, she seemed very tired, scared, sad, concerned about her husband since he was still in the hospital, and afraid about how she was going to navigate this system with him in the hospital.
And Anna just handheld me through every administrative decision that had to be made there. And whenever you talk to her, I don't know how she does this, but she sounds like she's smiling all the time.
Nurse care managers are available to you at no cost. They serve as a link between you and your family, your doctors, and the U.S. Family Health Plan to ensure that everyone is working together effectively. Your care manager will help you understand the care you're receiving, as well as your medical follow-up plan. They'll even remind you of your appointments and medication schedules.
It's a wonderful feeling to know that when both of us are going through these medical problems, her with her cancer and me with the 4 operations, that we have a staunch ally in trying to navigate through all these difficulties.
It's nice to get to know people over a period of time and really begin to grow those relationships. But while at the same time knowing that you're benefiting them and providing support, encouragement, advocacy, all of the things that I really love to do.
I cannot thank U.S. Family Health Plan enough for bringing my husband back to me. I was terrified that I had lost him, and they're the ones that walked me through and brought him home to me, and so now he's sassy, so I guess that means he's pretty back to normal.
We promise to do everything we can to equip you with the tools you need to live a healthy and fulfilling life. And only as a U.S. Family Health Plan member will you receive these additional services. Eyewear discounts up to 35% off retail prices. Discounts on complementary and alternative medicine services. 25% off professional-grade vitamins and supplements. Up to 80% off of health and fitness magazines. As well as free access to the Whole Health MD website, where you'll find everything from health information to recipes.
Being retired military myself, I believe that the U.S. Family Health Plan is probably the best alternative when you add up all the different things that you're really looking for in a health plan.
Private Coombs is preparing for his first deployment.
When I found out I was going to Iraq, it kind of scared me at first, you know. It's not the whole thing of being in a war, it's the whole thing of leaving my family for that amount of time.
With 3 kids, the Coombs have their hands full. They need a health care plan that meets their growing needs.
You have access to the top facilities in the area, but internally we have a small organization. We pride ourselves in the personal care that you will receive when you call our different departments.
When I called Martins Point, I spoke to Melissa. She gave me all the information. She was very exciting on the phone. She asked me what I was looking for, and I told her I had 3 children and I wanted to see a civilian doctor. She came to my house the next day and she enrolled me.
With year-round enrollment, you can enroll in the U.S. Family Health Plan at Martins Point any time of the year, as long as you meet our eligibility requirements.
Those eligible for the Uniformed Services Family Health Plan are military retirees and their eligible family members, Guard and Reserve at age 60, family members of active duty troops, unremarried eligible former spouses, widows and widowers.
Just call us to request an application or go to our website to download the form. We're available to answer your questions and will even assist you in filling out the application. If you are currently enrolled in a TRICARE Prime program, your enrollment with us will be effective the day we receive and process your application. If this is your initial enrollment in TRICARE Prime and you submit your application by the 20th of the month, enrollment will become effective on the first day of the following month.
When I get to Iraq, it's just a great feeling to know that my family will be taken care of.
They make it simple and easy. It is a great plan.
I believe that the U.S. Family Health Plan really brings across what TRICARE was meant to do, and that is bring quality health care and at affordable price to our retired military members and active duty family members.
We like to think that we are going to be your healthcare partner for life, simply because we're going to give you everything that you need to rest assured and sleep easy at night that your healthcare needs are going to be taken care of.
Martins Point always makes sure that they take that extra step to care for the families that have cared for us.
To the families just starting out, to those who are regaining their strength, or trying something new, whether you call home a rocky coastline, a green pasture, or an historic city. For all of you who have in some way made a difference by being part of the military family, we thank you and invite you to join our family, the U.S. Family Health Plan at Martins Point.